several ways to control the volume of your meeting. You can mute or unmute your line by pressing star 6. If you need to raise the volume of others, press star 4.
If you folks can please mute your lines when you're not speaking,
press star 5.
We can get started.
To lower the volume of others, press star 7. And if it's just your volume you want to lower, press star 8. To mute everyone at once, press star 9-6. You can then unmute everyone at once by pressing star 9-7. That was pretty fast. So if you need me to repeat this information, press star 1. If you're ready to hear about more advanced features, like how to set up private sub-meetings, press star 2. Or to hear about features like guest lists and roll call, press star 9. As always, to reach meeting support, press star 0.
In celebration of the Justice for Immigrants campaign 15-year anniversary. So today's webinar is titled Different Ways That You Can Support Migrants in Your Community During COVID-19. And we're going to be looking at different ways that local service providers and diocesan leaders from across the country have been adapting their services to support and help serve the needs of their communities and those who have been greatly impacted by COVID-19. We're also going to be providing some best practices for how you can help support migrants in your own communities. And we will also have time at the end of the webinar to answer any questions that you folks might have. So please feel free to write any questions you have in the chat box. Tony, can you go to the next slide, please? Okay, so we're joined today by a great group of panelists who will be sharing their expertise and experience in navigating and adapting to the challenges that the COVID-19 pandemic has brought about. So I'm going to be the moderator. My name's Sarah Hoff, and I'm with the U.S. CCB, the Migration and Refugee Services Office. And we're joined also by Bishop Bruce Lewandowski from the Archdiocese of Baltimore, Lisa Lundgren, who's the National Education and Outreach Coordinator for Anti-Trafficking with the USCCB, also Migration and Refugee Services Office. We're joined also by Elena Segura, who's the Senior Coordinator for Immigration Ministry with the Archdiocese of Chicago, Isaac Cuevas, who is the Director of Immigration and Public Affairs with the Archdiocese of Los Angeles, and Diana Otero, who is the Director of Operations and Support Services at the Center for Immigration and Legal Support Services with Catholic Charities of San Francisco. Next slide, please, Tony.
Hello, everyone.
Yeah.
Very nice to be with you. Very good. Thanks so much, Sarah. Our parish, Sacred Heart of Jesus, here in the Archdiocese of Baltimore, is the Center for Hispanic Ministry in the city of Baltimore. It is not the only Hispanic parish. There are 23 Hispanic parishes of Hispanic ministry, with Hispanic ministry in the Archdiocese of Baltimore. I'm currently an auxiliary bishop here and the vicar for Hispanic Catholics. Our parish has found out during this time of COVID how important it is to maintain and work with the partnerships that we have in the business community, among not-for-profit organizations, government agencies, and the private sector. Our parish is a member of BUILD. BUILD is a faith-based community organizing group here in Baltimore with over 40 years of history of community organizing with many churches. BUILD stands for Baltimoreans United in Leadership Development. With BUILD and with our partnership with Johns Hopkins Hospital, the hospital system here in Baltimore, we've been able to provide food right from the start of the pandemic in March to what's now from our parish here, 500 people a week. So we've been distributing food boxes door to door to families, especially those who have financial worry and difficulty because of loss of work or unemployment because of COVID, and also those who have had to isolate at home because of COVID. We did use our food delivery system to do much, much more than deliver food. We provided essential services to people when they were at home in quarantine. Services like making sure they had connections for their children to school when school went online, making sure that people, were getting advocacy in case they were in danger of being evicted or had problems because of unemployment or lack of unemployment insurance. So based on all that, our parish played a key role in developing what is a pilot program here in the city of Baltimore. That is working with Johns Hopkins, BUILD, the Baltimore City Health Department, the Maryland State Health Department. We've come up with a pilot for isolation support. So people who are tested here at the church, we have weekly testing in our parking lot for more than 20 weeks. People are tested in the parking lot. If they test positive, they get a food box, a visit from our parishioners. We have a team of parishioners that go out. They get from the city of Baltimore isolation support in the form of a cash supplement. So they get $1,000 of cash support for their family, and also the medical services that are offered by Johns Hopkins. That is specific to the Hispanic community here in the city of Baltimore, and our parish, as I said, was instrumental in working with the different organizations, not-for-profits, business sector, government agencies, in making that happen. And so I think just as a church community, as a parish, as a diocese, how important it is at times like these to maintain and nurture the partnerships we have that can really serve the immigrant community, in our case here specifically the Latino community. I want to mention one thing at the end here that our church has been involved in within our parish. We stole an idea from Chicago and the ministry there, Pastoral Migratoria, and adapted it. They had a wonderful program set up for circles of hope and support. We adapted their program here during COVID and formed small groups online where people who were isolating, people who had different needs, could pray together, share their stories and experiences together, and actually laugh a little bit, have time to share jokes, and humor can, solve a million ills sometimes. So the circles of hope, at the height of COVID, we had 20 circles. As things have opened up more, they're less and less. But that kind of support through Zoom, on the telephone, or Facebook groups was very crucial in helping us reach people and find out what they needed, and what they continue to need during this time. So our partnerships in the city here and at the state level with different agencies and community groups, and then building internally strong bonds for communication, prayer, and support have been crucial in helping our parishioners and many other people beyond our parish to work through and live through COVID.
Wonderful. Thank you so much, Bishop Bruce. That was great. Now we're going to move to Lisa, who's going to be talking about kind of ways that different power communities have been adapting to the pandemic, and kind of different ways that you can help refugees during the pandemic. So Lisa?
Thank you, Sarah. Can you hear me okay?
Yes.
Sure. Wonderful. Tony, next slide. Next slide. Thank you. It was a pleasure to be with everyone here today. Thank you so much for joining us on this panel, because it really is a critical time to accompany our brothers and sisters on the move, particularly during this tenuous time with the pandemic. And today I wanted to touch on ways to support refugees who have been resettled to our country. And while we know that resettlement is at a historic all-time low in our country, I just want to assure you that refugee resettlement agencies, including USCCB and its network of Catholic charities, partners across the country, continue to work very hard to welcome previously and newly arrived refugees. Next. So as we all know, and as Bishop told us, those most deeply affected by the pandemic are the most vulnerable, which include refugees. So the practical help and connections with caring volunteers is very much needed. First, it can take pressure off service providers, many who are trying to support resettled refugees and other newcomers, and whose needs have just been compounded due to COVID. Also, volunteers have specialized skills and knowledge that aren't always available in-house. And they can also spend one-on-one time helping with individual questions and concerns, particularly about how to stay safe during COVID, questions that are coming from refugee families, which is very, very helpful, especially when caseworkers are tied up. Volunteers offer refugees connection with a larger community, very, very important when refugees and all of us are feeling isolated now due to the virus. And volunteers also mobilize in-kind and financial resources, which are filling important gaps, such as help with rent and utilities as income drops due to job loss. So in our short time together, I just want to give you a few examples of what volunteers are doing to help refugees during COVID by introducing you briefly to the POWER program. Next slide. So for the 10th year, we've been working on it for a decade, USCCB is coordinating a program known as Parishes Organized to Welcome Immigrants and Refugees, also known as POWER, to foster integration among newcomers and host communities. This year, USCCB was able to award 24 Catholic charity agencies that have resettlement programs, award them funding to increase their number of volunteers who are supporting refugees. How are they doing this? They're recruiting, vetting, training, and involving parishioners and community members in key integration activities, whether that be literacy, job coaching, mentoring, and more. But as you can imagine, the work has really traditionally required in-person service, right? But in March, our 24 POWER sites had to take a drastic turn to adjust their goals to our new reality. Unfortunately, POWER has been an essential component of COVID response efforts. So let's see a couple of examples. Next slide. So in-kind donations. In-kind donations of furniture and household items have traditionally been greatly appreciated by refugee resettlement agencies because they need to make sure that each refugee family who arrives to the U.S. has a furnished apartment to call home. And as you can imagine, these needs of refugees have expanded during the pandemic. So many Catholic charities, including the city of Atlanta, Cleveland, and New York, have hosted what are known as drive-by drop-offs. And this is where parishes and community groups can leave no-contact donations of masks, hand sanitizers, and food gift cards to benefit families outside, and they can leave them outside in front of the offices. Next slide. Financial support. At several Catholic charities, volunteers have helped cover the rent or utility bills for refugees who have lost their employment due to COVID. And another beautiful example I wanted to give to you, a beautiful example of generosity, community members in Cleveland donated their stimulus checks to Catholic charities and asked that it be used to support their refugee clients. So Cleveland used the money to offer scholarships for very needed legal services. So it turns out, and many of you might know, that every member of a refugee family must apply to obtain lawful permanent residence status within 1 year upon arriving to the U.S. The application is over 18 pages long and really requires the assistance of an attorney to complete it properly. So in this picture, you'll see a father and his 3 children holding a thank you sign after being awarded this scholarship to receive legal services free of charge. Next slide. Virtual mentoring and tutoring. Many Catholic charities with POWER grants have had to shift their mentoring and tutoring online. In this slide, you can see English exercises being shared back and forth via WhatsApp between a refugee and a volunteer. And also, when it comes to online mentoring, although it has its challenges, we've heard from a lot of Catholic charity offices that the emotional support and encouragement of these virtual visits is really important to help mitigate that loneliness and isolation. And it really also provides volunteers an opportunity to be creative. such as parishioners in Atlanta who have recorded themselves teaching art activities and reading books out loud to refugee youth, who later download the recordings via Facebook Messenger or WhatsApp. Next slide. And finally, here are a few additional ways you can accompany refugees and also other newcomers that are living in your city or town. Some agencies look for volunteers to provide online tutoring specifically to refugee youth who, as you know, are struggling to adapt to school closings and also the virtual learning platforms. Other agencies just need volunteers to send welcome meals delivered to newly arrived families' homes from local restaurants. And a fun activity for those who have children is to have your children make homemade cards and send them to refugee families with kids their same age via snail mail. And I think the most important advice that we know, but it's important to remember, is to be open to what the greatest needs are in your community. So call your local resettlement office in your city or state, whether that be Catholic Charities or another organization, and ask them directly how you can be of most service. Next slide. And I'll leave you with a beautiful quote from a volunteer in Boston, because I think it really reminds us that when we speak about supporting immigrants and refugees, we are the ones receiving much more than giving. Being part of this effort to welcome a refugee family has been like touching the hem of Jesus' garment. Thank you so much.
Thank you so much, Lisa. That was wonderful. Now we're going to hear from Elena Segura, and she's going to speak to us about what the Archdiocese of Chicago is doing and what Pastoral Migratoria is doing and how they have adapted.
Thank you, Sarah. Is that sound okay, or there is an echo? Seems like.
Elena, if you have your computer speakers on, can you please turn them off?
Okay, here. Okay, yes.
Yeah, that's
now
better.
Can you hear me?
Yes,
better. Okay. Thank you so much for this opportunity to share with you of our work. We are so connected with this 15-year anniversary. Next slide, Tony. I just want to share with you where are we previous to that one. I think this is previous to this. There's one. Okay. Yes. Thank you. Yes. These webinars are being developed because of the 15 years anniversary of the Justice for Immigrants. And actually, the beginning of Pastoral Migratoria, for many of you might be asking, what's Pastoral Migratoria? Some of you might be familiar, but for the ones who are not familiar, just give you a very brief context. We started really as when the Justice for Immigrants campaign started in 2005. In 2007, the failure of immigration reform, that was the time that we had to ask ourselves, should we continue with this campaign or should we stop here? And thank God, this document called Aparecida, whose main architect is Pope Francis, arrived to us in Chicago, and we were really moved that the church is called to go to the periphery, that the church is called to work with the community, and the poor are actors of their own development. And these are agents of change. So with that inspiration, we began using the methodology of Aparecida, which is see, judge, and act. And I'm very pleased in every single encyclical or anything like that, our Pope Francis keeps repeating. Even last Sunday when this new encyclical was introduced, he keeps coming back to the same thing. And I think in 2008, since 2008, we've been working very closely with him, and we're delighted to use this methodology. We borrow from the Marino priest, I think, the whole community is the same, see, judge, and act, but we use the listening, which is the thing that we have to be in tune always what's happening around us, because the faith has to be actively involved when we are in tune with what's happening around us. That's the listening. The learning, which is the judge, is to discern what to do. What is that calling us to do? How could we organize ourselves? How we need to be prepared ourselves to respond? And the act, which is proclaim, see, judge an act, and we use the listen, learning, proclaiming, the proclaiming. How could we bring the reign of God concretely to the realities that we're living right now? Well, now we know the pandemic came up, and our leaders, who are they are the ones who are bringing change into their communities, bringing positive change into their communities. These are actors of their own development. They are the ones who are the ones who respond with concrete ways, with actions into the realities that they are living. Next. So when the pandemic came, the first thing that came to us, we've been working in this ministry. We started in Chicago. We are in rural areas in the diocese of Stockton, California. We are in Kansas City, Missouri. We are in New York. And soon, very soon, we're already with Baltimore. We're just delighted for that wonderful gift that God has given us. So in this, formation is pivotal for this ministry. Information is when the leaders themselves who are responding to this call are equipped and to see how God is calling us, how could we respond to the needs of the community. So when the pandemic came, because we always continuously and in continuous formation were practicing, this listening, learning, proclaiming. So the first thing was, what are we observing in our community? And the first thing that came from different leaders, we really need to be together as community, to at least to pray, to present ourselves in front of God and bring this painful reality that we have to live. So we organize, the leaders organize these 8-week weekly rosaries where they took leadership in various levels in the promotion, writing the intentions, the prayers and organizing. So it was beautiful to see that community. But we were together, and many times with our fears, but our joys, and seeing each other was very, very instrumental. So number one, the faith, the source of our faith and prayer as a community, as a national community, was very pivotal. Next. So one of the things that was very, very pivotal during this time was also how could we use technology. And in our immigrant community, many of them, they only have the cellular. They don't have a laptop. They don't have, desktops or laptops or tablets. They don't have many of them, but they do have their cellular. So we developed this train-the-trainer model that we train teams of diocesan groups. We have these 5 dioceses who participate in train the trainer, how to use technology. And the challenge was how to do a curriculum with popular language, very simple language, even in English, Spanish, and Polish. So because when you want to teach how to use Zoom, which was the most popular platform that everybody's using, how to use it, to explain and give a one-on-one support also was very, very important. So this way, even it was good to see some people were practicing the technology class by going to the rosary. So that way they were successful. How to use the chat, how to use the question, you can clap with the reactions and little things that they had. So that was a very important training that they did. Next. But as Bishop Bruce has been sharing, mental health has been a major thing, not just being, it's now, with a second wave and who knows, and the uncertainty to all of us, just to, when we listen what's happening in the community, how to respond to this need, to support each other, to come together, to be in one space, to be in our sacred space, and to create this sacred space virtually, because we've been doing these circles for years, for 5 years in different places, in Chicago, in different places in the country we've been used. But how to do virtually was the challenge. So we collaborated with a psychologist from Loyola University and a pastoral staff from CTU, the Catholic Theological Union, to really present the key elements, components of creating this space. Even basic things like you can have Our Lady of Guadalupe or the crucifix or some symbol very meaningful, even virtually. So those very important details have been very part of this, creating a space for people to communicate and talk. So we have a technology, but also we provided something very concrete to continue doing our ministry digitally. So that has been a major challenge. Next. So another thing that we've been introducing Pastoral Migratoria through our Summer Institute, always in July. We start planning in November. By the end of March, we click on send application. We literally were 2 weeks before the click, and then the pandemic came. So this Summer Institute is a 5-day immersion program. So we literally changed to a 5 new format, virtual formats, to reach the similar goals, to introduce Pastoral Migratoria, to strengthen the community, the national community, and to gain new partners. So we responded to critical issues like global migration in times of COVID. We realized that we're not only here in the U.S., migration is all over the world, and COVID is all over the world. How could we connect in a practical way? So it was wonderful that, and also DACA, systemic change in higher education institutions was very practical also, not just you were waiting for a systemic change at the federal level, but in our Catholic reality, many even Catholic universities are not necessarily very open to have DACA students within their systems, but we have good models, and so we were able to highlight that reality that is happening. Systemic changes are happening even in the Catholic institutions. Next. And so as a result of these adaptations to this reality, yes, we reach our goals in the Summer Institute. We introduced not just the 12 in 2018, 15 in 2019, but we really reached out to around 70 dioceses in the country and even 20 in Mexico and other places in the country. That was a beautiful surprise to me, with a global, we enlarge, and Pope Francis probably saying we open our arms, and we're finding other people's arms and seeing one community. That has been a wonderful experience for us, and also gaining new partners. We have 20 new partners in this process, and of course with the social media, expanding our community. So just to finish, one wonderful opportunity that we have was finding new leaders. Our Red Nacional of Pastoral Migratoria, which we've been doing this bi-monthly forums since 2019. So we had that experience, but now we have a new leadership who are going to help us to enter to the next stage of the Red Nacional. We have our national community has expanded and strengthened. We're connecting more. And also we are connected with the international community. And we have a blossom of partnership. And that has been a blessing for us to see these leaders who are really bringing changes to their communities, and they are protagonists of their own destiny through this ministry. Thank you very much.
Thank you so much, Elena. That was great. Now we're going to hear from Isaac Cuevas with the Archdiocese of Los Angeles, and he's going to speak to us a little bit about how they've been adapting their services and kind of about the resources that they've created throughout the pandemic to kind of support those who have been impacted by COVID-19. So Isaac?
Thank you so much, Sarah. Can you guys hear me okay?
Yes.
Perfect. Well, first of all, thank you so much for having me on here, and a quick thank you to all of our panelists who are amazing. Elena's a mentor of mine, and love and appreciate the work that she does, and we've adopted this Pastoral Migratoria model here in Los Angeles as well. So again, it's just great to be part of such an amazing group, and thank you for the invitation. One more quick little note, in Los Angeles, we're getting really close to lunchtime, and my quarantine coworkers, more affectionately known as my son and daughter, may be in the background plugging away at the microwave or something, so if you hear that, please just disregard. That said, again, my name is Isaac Cuevas with the Office of Immigration Affairs for the LA Archdiocese. And when the pandemic first hit, I'm sure like many of you, we all immediately kind of tried to understand what was going on and how this would impact our parishes, our communities. And under my role as not just immigration affairs, but also public affairs, it is also my responsibility to be in touch and with our civic leaders at the county level, at the city level, which in Los Angeles is huge because our territory is expansive, and we also do cover 3 major counties. Now, I know many other dioceses across the country cover many more many more counties. And ultimately, the efforts and the guidelines that are put forward around the pandemic are all based on the county. They start and originate with the state-ordered issues, and then they trickle down, and every county has to be responsible for what happens at the local level. So immediately for us, it was trying to get an understanding of how to make sure that we were being as informational as possible, while at the same time not overloading people with too much. Tony, if you can go to the next slide, please. So what I'll cover off here today with you all is a quick understanding as this pertains to the immigrant community specifically. First and foremost, we wanted to really kind of accurately explain the need. When I say explain the need, Archbishop Gomez knew that we had tons of resources already mobilized, many similar to what you've heard from our other panelists. And what I wanted to tell you guys all about a little bit more was the emphasis on speaking directly to Hispanic ministry priests, right? So Archbishop Gomez tasked me with putting together a presentation that wouldn't just cover all the guidelines that were happening locally, but also would give people some practical things that they can do. So we wanted to explain the need within the immigrant community, why this was different than other potential communities, explain examples of what people can do to protect themselves, to protect their families, how to reach out for resources, make sure that we keep things simple. And again, many of our guidelines and many of our resources and how the county has applied those restrictions to us, we've translated those through our offices. We've made sure that we've made them simple and easy to understand how they pertain to us practicing our Catholic faith within our parishes, but also making sure that it was simple enough for everyone to understand. And then offering resources, making sure that every priest knows and understands that resources are available to anybody who may be coming to the church with need. So Tony, if you can go to the next slide. And obviously what we did was we put together this presentation. Now please know I have this presentation. I'm happy to make it available to anybody who would like to use it. I did only take out a few slides, but it's, I want to say about maybe 16 or 17 slides. I'm not going to go through all of those, obviously. I just pulled out the ones that were more critical. And please know that these slides are also in many ways hyper-targeted to Los Angeles. But again, if you can use them for your own benefit and adapt them for your county and your guidelines, please let me know, and I'm happy to make that available. Tony, next slide. And we made the presentation available in both English and Spanish. First was explaining the need. So what we realized by looking at the data is that overwhelmingly the impact to the Hispanic community or communities of color, the percentage of death was much higher than the average. Why does this happen? There's many theories. One is that many people within minority communities are more prone to being frontline workers. There are people that are out. There are people that need to be out. They need to work. They also many times come home to bigger households, sometimes households with multiple families. Thus, the impact of someone being infected by the virus coming home, there's a bigger potential and a bigger chance of spread. But also from a health standpoint, many minority communities are in greater categories of risk, and therefore the percentage of potential death cases we noticed was something that was going much higher than the average, than what was the average. So you can look at this data and realize that this is happening pretty much across the country. Tony, next slide. And so again, focusing on the need. my office has been part of our contact tracing, and what we did in this process was anytime that somebody was infected with the virus locally, at any parish, school, Catholic cemetery, any institution that belonged to the diocese, we made sure that we received those phone calls, did some contact tracing. When was a person infected? When was the last time they were on property? Was there any potential of exposure for other people? And this is lay people as well as priests. Explaining this to our clergy and making sure that they knew and understood the responsibility of reporting this to us, not for the sake of reporting this to anyone else, but just for our basic understanding of trends and what was happening and how the virus was progressing. And I have to tell you, overwhelmingly, anytime that we saw numbers generally increase within city and county cases, we saw those same kind of increases within our parishes and our parish communities. And likewise, when we saw decreases, we also saw decreases across the board. And one of the things that we realized was, and I wanted to use this slide as an example, our maintenance people within the parishes were all of a sudden being reported with more frequency to our tracing hotline. And we started noticing, and we started asking questions, why is it more and more maintenance workers within our different locations? Why are they going through these, why are they all of a sudden testing positive with more frequency? So we made it a point to include in our presentation this need of something as simple as knowing the right way to remove your gloves. Many of the people that were doing maintenance work in our parishes were people that had been doing the same job for years and years and years. And they continue cleaning and continue doing everything the same way they always have. Take a rag out, wipe it down, put the rag back in your back pocket or anywhere else, maybe wash your hands and go and have lunch. Now with the virus, the importance of emphasizing how to use and making sure that everyone was wearing gloves, but not just wearing gloves, the proper way to remove gloves. So during the presentation, I actually made sure to bring a pair of gloves, put them on, and then properly took them off by removing them, flipping them inside out as you remove them to make sure that any germs and anything that's on the outside of the gloves stays within the glove. Something as simple as that was important in educating people down the line. So when priests heard this, they made sure to call in their staff, call in their employees, and instill this as a new protocol, if you will. We immediately saw numbers pretty much diminish in terms of the people that were impacted in our service component here at the diocese. Next, Tony. And again, here's a very easy example of how to keep things simple. There's our employees were having a hard time understanding what it meant to, what the quarantine actually meant. Many times they would come to work. They felt because they were at work and they knew these people, it was okay not to wear masks around one another. Our parishes were closed to the public, but open as essential businesses and open for day-to-day operations. So we had to make it a point to kind of simplify the things that needed to happen. And what we encouraged was priests to do things and make it real simple. Educate their employees on what to do within the parish, right? Wear your mask, keep the distancing. Encourage them when they're doing things right and when they're abiding by all of these procedures, and also gently enforce the protocols when you see that these procedures are not being met. And again, remember, right now it seems kind of common and general knowledge and general understanding, yet still there were people who weren't all the way on board with the idea, the notion of wearing masks or distancing, or thinking that this was something that was going to impact them in any kind of way. And then we also obviously know that every employee has their personal life, but making sure that they know and understand to avoid things like crowd, close contact, and confined spaces. Again, not just for the sake of protecting the people that they work with, protecting the people that they're with at home. Many times we would see that employees, especially once they started being a little bit more lenient with the guidelines here in Los Angeles, employees would go out at night to restaurants, to bars, to, places where there was gatherings. And this is when, once again, we saw the numbers go up. And explaining this to our priests helped give us a little bit more of a reach into our community and helping to protect more people. Next, Tony. And finally, again, this is a one-pager that we made available to all of our priests. This was a list of pantries, food pantries, health resources. Elena Segura mentioned mental health resources. We also partnered with the County of Los Angeles, who offered us a dedicated hotline for anyone who had concerns about their mental health, and made that available not just to diocesan employees, but pretty much anyone in our parishes. We included that as part of this presentation, and we offered this one-page resource for people to use in the handout that was divided regionally, territory by territory. What we started seeing is that more and more pantries, food donation centers, they were running out of food. There was new ones popping up every day. And the other benefit that we had was that there was a tremendous amount of people that wanted to volunteer and wanted to offer to help. So we took those volunteers, we empowered them, we created a hotline, and that hotline served as an opportunity for our volunteers to answer calls, get back to people who needed the help, and offer these resources that we updated pretty much every 2 days, calling the different centers, making sure they were still available, making sure they were still open. If they were closed, we would update that, making sure that we weren't sending people to places that maybe had already been closed or maybe had more restrictions as to how they would offer help and resources. So again, a very simple explanation of this and how this process works for our priests help make them feel a little bit more secure and a little bit more aware of how to offer that help and those resources to our community. I think that's it for me.
Thank you so much, Isaac. That was great. And finally, we're going to hear from Diana Otero with the Catholic Charities of San Francisco about how they've been adapting their services and kind of the different ways that they've been going about kind of supporting the immigrants in their communities and those who are in need of legal assistance. So Diana?
Thank you so much, Sarah. I do wanted to echo Isaac's words of gratitude for the amazing work that every one of my colleagues is doing to serve our refugees and immigrants. Thank you so much for putting your faith in action. This is amazing. Thank you. Next slide, please. During this unprecedented time of COVID-19 at Catholic Charities San Francisco, we are tirelessly supporting those in our community who are most vulnerable and at risk. Undocumented immigrants have been deeply impacted by this public health emergency. Their needs and challenges are greater than ever. COVID-19 has presented our immigrant community with many challenges such as job loss, food and financial insecurity, and housing instability. And even though undocumented immigrants and refugees are significant contributors to our U.S. economy and social fabric, they have not been eligible for federal COVID-19 related assistance. To help this vulnerable community with the financial burden resulting from the pandemic, the state of California created the Disaster Relief Assistance for Immigrants, DRE project, which provided one-time state-funded disaster relief assistance to undocumented adults who were ineligible for other forms of assistance due to their immigration status. As a member of a network of trusted nonprofit organizations throughout California, we helped undocumented adults apply for this vital DRE support. This assistance helps immigrants and their families who experience financial hardship as a result of COVID-19 with food, shelter, medical and childcare, and other basic expenses. The funding reached out about 150,000 undocumented adults statewide, and of this amount, we served 30,000, along with Catholic Charities Santa Clara and Catholic Charities of the East Bay, distributing $15 million. And we could not have done it alone. We were able to bring many of our furloughed staff. We got the support of amazing volunteers that helped us with calls and processing cards. During this time, we received close to 3 million phone calls. We did this within a month and a half, and we got like 3 million phone calls. And it was like we knew how important this type of services was, and the fact that we were able to have volunteers helping us and providing support was incredible. We were also blessed to have 4 seminarians that came and spent almost a month with us, calling people, processing cards, approving applications. So it was incredible. We have also been receiving the support of local parishes and other congregations and religious groups. They reach out to us and have provided us with funding to help support the financial needs of our community. We were able to distribute cash assistance and gift cards to our unaccompanied minors immediately after the pandemic hit, again, through generous donations from partners and several relief funds. Next slide, please. 56.9% of Latinos are housing cost burdened, spending about a third of their income on housing, leaving very little to get food and other essential supplies. Because of that, we have been coordinating food distribution drives with many community partners, drive up and walk out of our office and at different locations. We have been delivering hygiene supplies, including diapers, wipes, and other baby items for moms. And again, as you can see in those pictures, like without the help of amazing volunteers, it was going to be impossible to be able to do this alone. Next slide, please. During this pandemic, it has been clear the gap that exists between those with ready access to communication technologies and the knowledge that they provide access to, and those without such access or skills. To address this digital divide, we are helping our clients set up emails, teaching them how to download apps, accessing the internet, connecting to Wi-Fi, and acquiring hotspots. We have been able to provide some devices, school supplies, desks, chairs, printers, really to try to help them with remote learning. And again, I think that the common theme of what I'm going to talk to today is that alone we are not going to be able to do this, that we need more hands. The amazing support of our community have made a difference. When we ask them, like, we have these families, they are now at home, they need desks, they need computers. We have been seeing how people are really responding and helping us, and we are extremely grateful for that. We have been turning to technology as a way to connect with our community and bring them important updates. COVID has challenged us to get creative and finding ways to reach our clients. We are now doing more events using Facebook Live, trying really to use the technology that they are familiar with. Like, we know that they know how to use Facebook, WhatsApp, and we are really trying to use those technologies to connect with them. We're trying to send more text messages, but then again, going back to what is needed, teaching them how to use it first so that they are able to get the information that is so important for them. And when we did this DRAPE project, and it was very clear to us that there was a lot of people. Number one, for many of them, they didn't really have the money to pay their cell phone, so they might not even have a phone at home, and not even a computer, right? Like that's a luxury for many of them. So really going into the basics and really trying to understand where our clients were and where the community is at, it was very important. Next slide, please. In order to provide services, we needed to shift from in-person services to virtual services. We have been able to continue providing legal services remotely. We're doing DACA applications, NAS applications, adjustment of status. We are doing drive-throughs so people can come and pick up their application packages. Recently, we were facing a possible increase in fees, and we really work hard to make sure that our community, and especially the most vulnerable among us, were able to submit their applications on time, and definitely being able to figure out how we could have many of our clients come into our offices and sign documents, because as I mentioned before, perhaps it's not that simple for some of them to scan documents, to sign documents online. So we are really trying to be creative in finding ways to make sure that we can accommodate their needs, and at the same time making sure that we are safe. Next slide, please. Thank you, Tony. We are partnering with other agencies, connecting with other partners. We wanted to make sure that we research and connect clients to community, government, and private resources. At this time, when they need a lot of support, we wanted to be the bridge and making sure that we present them with more opportunities and services, and making sure that they understand that those accessing to those services and benefits will not impact their immigration status in the future. They are very afraid about public charge, so we're really trying hard to talk to them and do a lot of presentation and talk about the myths and making sure that they understand that by accessing these type of services, they are not going to be affected in the future. This is not going to be affecting them. We are continuing trying to do more outreach activities and trying to really assess all the needs of our community right now, and I feel that during times of challenges like this, we are forced to look to other people and to work as a community. And I think that COVID has forced us to do that, to continue to feel that by doing things alone, we go far, but if we do it with more people, if we are able to work together, we can definitely reach out to many more people and support and help more. And I'm very glad that we were able, as you can see in the pictures, we partnered with Vegan Outreach, and they are providing us with fresh fruits and vegetables and delicious food for our clients. We are also partnering with the San Mateo Sheriff County Parent Program. They have like a variety of services that they can provide to our community. So here it's a matter of like, what can we do not to duplicate services? How can we work not necessarily harder, but how can we do it in a smart way that we can serve more people and really use the limited resources that we have properly. And also we were also able to reach out and to connect with counseling services, because during this pandemic, as we are ongoing, like doing like needs assessments and trying to figure out what is it that our community needs the most, it was very clear that the need for counseling services was very important, and so we have been able to reach out to some local organizations, and they are going to be able to provide counseling services for our community. So this pandemic has been very challenging, but I think that we are going to continue working really hard to support our clients. They are our North Star, and making sure that they get the services that they need. We're going to continue building relationships and working together to support them. So thank you so much for this opportunity, and I'm really looking forward to questions from the public.
Great. Thank you so much, Diana, and thank you to all our presenters for sharing their insights and the work that they've been doing during this pandemic and kind of how they've been adapting. So we have a little bit of time for questions. So I think I saw one question for Elena in the chat. Elena, for you, somebody asked if they could access the manuals that explain how to use Zoom online.
Oh yeah, we do have. Maybe if you reach us, we will be happy to share those manuals in Spanish, English, and Polish. Anybody. Probably what you need to do is just let me give you the email of Raimundo Valdez. Is R Valdez VALDZ at rchicago.org. I'm gonna send you in the chat. I'll put that address there, so you'll be more than happy. Just get in touch with him, and he will share with you our manuals. It should be online too, but he's the one who knows more than me. So we'll be happy to share.
Wonderful. Thank you so much. And we have another question asking if Isaac could make his slides available to the attendees. So your PowerPoint that you had in English and Spanish, Isaac.
Yes, absolutely. In the words of Archbishop Gomez, work harder, not smarter, which is why I love and appreciate him so much. So please do not try to recreate the whole thing. Use what I've already used as what I've already made as your example, and adapt it as you see fit. So please, I will include my email in the chat, and anybody who would like to access this, just send me a note and I'll be happy to make it available.
Wonderful. And we're kind of coming up on time here, so if anyone else has any questions, they can feel free to send an email to me. I will put my email in the chat as well, so you can do that. And I just kind of wanted to remind folks that, or give them a heads up about the next webinar that will be in our series. So it's going to be next Wednesday at 2 p.m. Eastern, and it will be on seeking asylum during the coronavirus pandemic. And so this panel is going to focus on kind of the rapidly changing asylum landscape that's been happening under the Trump administration, and it will kind of discuss different policies and decisions that have been happening during the COVID-19 pandemic, and they'll also discuss different ways which Catholics and different concerned individuals can support victims during this time and kind of advocate for change. So with that, I think we're pretty much out of time. So I want to thank you all for joining us today and for participating, and thank you again to our presenters for kind of sharing their work and what they've been doing. And this webinar and all the webinars in this series are being recorded. So if you missed anything or you would like to share this or watch it again, you can do so. They will be up on the JFI website, usually within the next few days after this webinar is done. So you can do that there. So thank you all so much for joining us, and I hope that you have a great rest of your day. Thank you.